Audio is required for this course. Please make sure you have a device that plays audio and the audio is enabled. The player seek bar is currently disabled. The audio must finish playing before you can advance to the next slide.
Introduction. About this course. Your job as an employee of a senior care community is important to the well-being of others. Many of the residents who live in your community are elderly and need special care. While most residents are able to care for themselves, some may be physically frail or weak, and some may have cognitive impairments. Cognitive impairment describes the confusion, disorientation, and memory loss associated with some disease processes. One of the most common disease processes that causes cognitive impairment, especially in older adults, is dementia. By understanding how cognitive impairment may affect residents, you will be ready to help when needed. In this course, you will learn the effects of dementia on residents and their loved ones, as well as guidelines to follow to maximize residents' functional abilities. If you require special accommodations to complete this module, please contact Relias Learning Customer Support by calling 1-800-381-2321 or emailing support@reliaslearning.com. In order to access supplemental information related to this specific module, please visit the Resources slide located in the final section of this module. Learning objectives. After taking this course, you should be able to identify the effect each stage of dementia has on residents. Recognize the effect dementia has on residents' loved ones. Explain how you can maximize residents' functional abilities. Effects of dementia. What is dementia? Have you ever forgotten where you put your keys? How did you feel the last time that happened? Did you feel frustrated or angry? Some residents in your assisted living community feel that way every day. They feel frustrated because they cannot remember what they had for lunch or their children's names. They become angry because simple activities such as getting dressed are not as simple anymore. Temporarily forgetting where you put your keys is normal and occurs to almost everyone at one point or another. Forgetting what you ate for lunch, your children's name, and how to complete basic tasks is not normal. These are all signs of cognitive impairment. Cognitive impairment includes difficulty making decisions, remembering, learning, and concentrating. One of the most common causes of cognitive impairment is dementia. Dementia is actually not one single disease, but rather a loss of brain function. It is a term that refers to a group of illnesses that cause memory, behavior, learning, and communication problems. These problems are caused by damage to the brain cells responsible for storing memories, forming words, understanding speech, and many other intellectual functions. Causes of dementia. Most forms of dementia progressively worsen over time. Alzheimer's disease is the most common cause of progressive dementia. Other causes include Parkinson's disease, Huntington's disease, Pick's disease, stroke, chronic alcohol use, brain tumors, and AIDS. Some conditions such as infections, thyroid problems, or vitamin deficiencies can cause dementia as well. These forms of dementia are reversible as long as the resident gets the appropriate treatment. In older adults, depression often mimics the symptoms of dementia, but is not a cause of dementia. Stages of dementia. There are 3 different stages of dementia: early, middle, and late. The signs and symptoms of each stage are different depending on the severity of cognitive impairment. Click the tabs below to learn more about each stage. In the early stage of dementia, family members often describe the person as forgetful. However, impairment goes beyond forgetfulness. Residents in the early stage of dementia may have difficulty performing complex tasks, such as following a recipe or managing their medication. They may get lost in familiar places or misplace things. They may have difficulty finding the word they want to use or may use the wrong word altogether. These residents may not be able to remember things that happened 10 minutes before. This is short-term memory loss. However, in the early stage of dementia, residents are still able to remember things they did in the past. In other words, their long-term memory is still intact. During this stage, residents may be able to hide the symptoms of dementia from their family and friends. In the middle stage of dementia, cognitive impairment progresses significantly and becomes more apparent. Basic care tasks, such as getting dressed, become difficult. Residents may attempt to use objects incorrectly, such as trying to use a spoon to cut their meat. The inability to process information leads to communication difficulties and difficulty making decisions. Residents may make up words or will put words into a sentence that make no sense to others. Nonverbal communication, such as with the use of behaviors, becomes a key way they communicate discomfort. It is during this stage that you will see an increase in frustration and anger. This is because the residents cannot do things the way they have in the past or cannot understand what is going on around them. Memory loss now affects both short and long-term memory. They may even be unable to recognize family and friends. Other symptoms commonly exhibited during the middle stage of dementia are wandering, restlessness, incontinence, hallucinations, delusions, personality changes, and poor judgment. As residents enter the late stage of dementia, they lose the ability to perform the most basic of tasks, such as walking, sitting up straight, smiling, or even swallowing. During this stage, residents are completely dependent on others for care. Communication is likely to be limited to 1 or 2 words, if present at all. Secondary victims. The effects that dementia has on the resident are readily apparent. What is not so apparent are the effects that dementia has on the resident's family and friends. They are the secondary victims of dementia. Every person's relationship with individual family members is unique. Dementia robs a person of the memories and experiences that make up personal relationships. Consequently, relationships such as husband-wife, mother-daughter, and father-son may lose integrity as the person's mental capacity deteriorates. Additionally, loved ones have to deal with the resident's changing behavior and personality. The resident's loved ones may feel that they don't know who the person is anymore. Behavior and personality changes that are dramatic are the ones that are most difficult for loved ones to cope with. For example, a female resident who used to be very modest now displays inappropriate sexual behaviors. This can be very difficult for the resident's husband or son to understand and cope with. Emotional reaction. The loved ones of residents with dementia oftentimes experience a sense of loss as dementia progresses. That is, a loss of relationships and a loss of the person they once were. The emotional reaction to a loss is different from person to person, but most people go through some type of grief process in response to loss. Anger is a very common emotional reaction to loss. Residents' loved ones may actually take out their anger on you, so it is important for you to know how to handle these situations. First, you need to remember not to take their anger personally. The family member is actually angry at the disease, not at you. Next, move the family member to someplace quiet by saying, "Let's go somewhere we can talk privately," as just the act of moving can have a calming effect. Once you have moved to a quiet place, listen, and listen some more. Then reflect back to the person what you heard them say. For example, "I wish I could change what has happened to you. It's not fair, is it?" Be sure to use caring statements and always avoid defensive responses. Review. Match each symptom to the appropriate stage of dementia by dragging and dropping. Summary. Dementia is the loss of brain function that causes problems with memory, behavior, learning, and communication. Each stage of dementia has a different effect on residents' cognitive ability, resulting in different signs and symptoms, depending on the level of cognitive impairment. You will see mild cognitive impairment in the early stage, followed by more significant and apparent cognitive impairment in the middle stage. By the late stage of dementia, the resident has lost the ability to perform even the most basic tasks. This devastating disease also has a tremendous effect on residents' loved ones or the secondary victims. A sense of loss often accompanies the diagnosis and progression of dementia. This sense of loss leads to a variety of emotional reactions, one of the most common being anger. Providing person-centered care. More than a disease. It is more important to know what person the disease has than what disease the person has. Hippocrates. Knowing a resident as a person, not just their disease, is an important part of person-centered care. In this interaction, you are required to demonstrate your knowledge of person-centered care by completing two separate tasks. Click on the photos of the residents below to complete their associated learning activities. Mr. Menendez. Mr. Menendez admitted to Prairie Living 3 weeks ago with a diagnosis of dementia. He spent his entire career in the Army as a drill sergeant, so he is very much set to a particular schedule. Changes in his daily routine make him very agitated. Based on the following clues, arrange Mr. Menendez's morning schedule according to his preferences by dragging and dropping the tasks into the correct order. The tasks will turn green when they are in the correct slot. Mr. Menendez's shower must occur before his wife visits, and she always visits right after he has taken his nap. He also attends the daily current event discussion. The current event discussion never happens right after breakfast. Mr. Menendez always wants to take a shower immediately before the group discussion. Mr. Menendez always starts his morning out with breakfast. Correct, you were able to arrange Mr. Menendez's schedule to meet his needs and preferences. That is person-centered care. Person-centered care involves focusing on the person, not the task. Forcing a person with dementia into a routine that is convenient for staff, but that is not part of the resident's personal history or habits, may result in resistance. This means that you will have to be flexible, patient, and sometimes creative when providing care. Person-centered care also involves getting to know the resident as a person as well as what their capabilities are. Ms. Fisher. Ms. Doris Fisher was admitted to Prairie Living 2 years ago with early-stage dementia. She was a stay-at-home mom up until her last child left for college, at which time she decided to pursue one of her long-time interests and opened up a small bakery in town. Ever since her oldest son got a job coaching baseball for the local community college, Ms. Fisher has been a die-hard Redbirds fan. She likes reading good books, watching any of the classic movies other than westerns, playing cards, and completing puzzles. Her daughter says Mom has always been a social butterfly. Anything that involves other people and good conversation, she's there. Using what you know about Ms. Fisher, identify which group activities are most appropriate for her by selecting one for each time slot. Of course, if this were a real resident you were working with, you would always want to include them in the decision-making process. Ms. Fisher stays for the entire activity and comes out with a huge smile on her face and a little flower in her hair. Ms. Fisher comes back from the group outing tired, but thrilled that she was able to see her son coach and the last home game of the season. Ms. Fisher stays for the entire activity and is an active participant in the discussion. Communication techniques. One of the major difficulties residents with dementia face is with communication. The inability to communicate their needs and wants is a significant source of frustration and anger for residents with dementia. Always use the appropriate communication techniques with each resident you encounter. Click the buttons below to learn more. First, you have to remember that a loss of brain function causes the resident to be unable to process information as quickly as before. Be patient during your communications. Give the resident plenty of time to process and respond to information. Be sure to set the stage for communication. Make eye contact with the resident and introduce yourself. Eliminate background noise, as it can be distracting for the resident with dementia. Make sure the resident is using any necessary assistive devices such as glasses or hearing aids. Try using short sentences that provide simple instructions. For example, rather than saying, "Please eat your dinner," say, "Please pick up your fork." When asking the resident to make a decision, it may be helpful to limit their options to no more than 2. Do you want meatloaf or fish for dinner? You may even need to ask only yes or no questions. Use positive terms whenever possible instead of negative terms. Instead of saying, "Don't go outside," say, "Let's please stay inside." If a resident is performing a task incorrectly, suggest that they try doing it a different way by saying, "Let's try it this way." Always praise the person and thank them for their help completing a task. Residents with dementia are very sensitive to nonverbal communication. So watch your tone of voice and body language. Make sure that it matches what you are saying, as this will oftentimes help the resident understand your message. The don't list. Some methods of communication will not work with persons with dementia. They are more likely to further confuse the resident or add to the resident's frustration. Never yell, scold, make fun of, or belittle a resident with dementia. Never use elder speak when communicating with residents. Elder speak is talking to an older adult as if you were speaking to a child. The use of terms of endearment such as honey or sweetie and speaking too slowly are all forms of elder speak. This also includes the inappropriate use of plural pronouns such as asking the resident, "Are we ready for our bath?" This communication style is patronizing and demeaning to the resident. In fact, research has found that the use of elder speak increases the chance that residents with dementia will resist care. Never talk as if the resident is not there. Instead, involve the resident in the conversation. For example, if while working with Mr. Wong in the Day Area, his daughter arrives and asks you how Mr. Wong's day went, you might respond, "Well, Mr. Wong, how has your day been? You seem to really enjoy the Clint Eastwood movie this afternoon." Do not ask the person with dementia, "Do you remember?" It is nearly impossible for a resident with dementia to answer questions about recent events. As memory loss progresses, it may even be difficult for residents to answer questions about past events. Never try to argue or reason with a resident with dementia. Even if your argument is valid, a person with dementia is unlikely to see the validity in your argument. Unless there is a safety issue, just accept what the person is saying is their reality. Physical environment. The senior care community where you work is the resident's home. Like you, residents want to feel comfortable and safe in their home. Unfortunately, the physical environment and the people within it are a common source of frustration and anger. Therefore, you may need to make certain modifications to the resident's home for it to be as safe, comfortable, and manageable as possible. Click each tab to learn more. Mirrors may be a source of distress for residents with dementia. This is because they are unable to recognize that the image in the mirror is their reflection. Rather, they think that someone else is in the room with them. Avoid the use of mirrors in the apartments of residents with dementia. If a bathroom mirror is present, you may need to cover it when not providing care. Pay attention to the noise level within the community, such as dining rooms or day rooms. Too much noise within the environment can be overwhelming for residents with dementia. This is because their brains are unable to process all of the incoming sensory information. Try to keep unnecessary background noises reduced. Some residents with dementia have difficulty remembering key areas within the community or even within their own apartment. Visual cues such as signs with pictures and words will help the resident find these key areas independently. A photo or other type of memorabilia on residents' doors may help them locate their apartment. Residents with dementia are at an increased risk for falls. This is because their brain does not perceive dangers within the environment. Hallways and walkways between the resident's apartment and key areas within the community should be free from clutter. ADL care. Activities of daily living, ADLs, are basic self-care activities such as dressing and bathing. Because residents with dementia may have forgotten how to do even these most basic of activities, completing ADL care can be a source of frustration for both you and the resident. By following some general guidelines, you can help prevent this frustration and enhance the resident's functional ability. Click the buttons below to learn more about ADL care guidelines. Demonstrate the task you want the person to perform. For example, mimic the use of a toothbrush. Break down complex tasks into simpler tasks. Allow plenty of time for the resident to complete the task. Remember, it takes time for residents with dementia to process information, so do not rush them. Allow the resident to do as much of the task as possible. Always provide praise to the resident after completion of a task. Click the buttons below to learn more about ADL care guidelines. Try to complete ADL care during the resident's best time of day. This is when their cognitive ability is at its highest. For residents with dementia, this time is usually in the morning, but it may vary. When assisting the resident with dressing, it is helpful to lay out the clothing in the order the resident will put them on. This keeps them from becoming confused about which article to put on first. Encourage the family to purchase clothing that is easy to put on, such as pants with elastic waistbands instead of buttons and zippers. Bathing is a very personal and private experience, so you will need to take additional steps when assisting with this task to prevent distress. Always make sure to follow any preferences the individual has for bathing. Trying to get a resident who likes to take a bath to take a shower will likely not go over well. Be sure to prepare the bathroom in advance. For example, make sure your supplies are within reach and the room is at a comfortable temperature. Always provide as much privacy as possible during the task. Dealing with difficult behaviors. Despite your best efforts, there will be times when residents with dementia will demonstrate difficult behaviors. These behaviors may pose a safety risk to the resident or may be bothersome to other residents within the community. Additionally, they are a source of added stress for caregivers and family members. Most behaviors are a way for the resident to express an unmet need or want, so you should always try to find the meaning behind the behavior. Determining the meaning of the behavior will help you identify the appropriate intervention. Click on the tabs to learn more. When a person with dementia rummages, it usually indicates that the resident is looking for something, such as a misplaced item or food. While this is seemingly a harmless behavior, it can pose a safety hazard if the resident gets into things that are harmful, such as chemicals or sharp objects. You should always be sure that you keep harmful items in a locked cabinet or closet. Rummaging may also become a problem if residents with dementia are rummaging through other residents' belongings. Many assisted living communities have found it useful to provide safe areas within the community for residents with dementia to rummage. For example, a chest located in the day room that is full of odds and ends provides a safe area for residents with dementia to rummage. As with rummaging, wandering behaviors generally indicate that the resident is looking for something. Maybe the resident is looking for the bathroom, or maybe the resident is looking for someone. Wandering behaviors usually do not pose a safety hazard as long as the resident has a safe place to wander. Many communities have a designated walking path that includes various things for the resident to look at. However, there is a safety risk when residents try to leave the community unattended. In these situations, you may be able to redirect the resident with an activity or a snack. If the resident is persistent, you may want to take them for a walk outside, then gently start to guide them back to the community after a few minutes. Agitation and aggression are usually the resident's way of communicating discomfort. Internal factors such as hunger, pain, or constipation, and environmental factors such as too much noise or unfamiliar surroundings may be the source of discomfort. You can also cause a resident discomfort if your approach with the resident is inappropriate. For example, maybe you are providing too much assistance with a task or not enough assistance. You should never ignore the behavior, as this can make things worse. The best way to manage the behavior is to eliminate the source of discomfort, if possible. Approach the resident in a calm, soothing manner and provide reassurance. Offering a distraction may help as well. A gentle touch, such as rubbing the resident's back, may help the resident calm down. Sexual needs and desires are a normal part of life, and they do not change just because a person has dementia. However, persons with dementia oftentimes display inappropriate sexual behaviors, such as disrobing or masturbating in public. When a resident is displaying inappropriate sexual behaviors, you must be careful not to scold, shame, embarrass, or draw unnecessary attention to the behaviors. Instead, calmly and firmly direct the resident to a private area. You must also remember that these behaviors may appear to be sexual in nature, but may have another cause. For example, if a resident is touching their genitalia, it may mean they need to use the bathroom. Alternatively, disrobing in public could mean that the individual is hot and needs cooler clothing. Support for the family. Your caregiving is not limited to supporting the resident, but you also need to help support the resident's family while they are dealing with their loss. Encourage them to join a support group and to get as much education about the disease process as they can. Help educate them on what the resident's behavior means and what they can do to help. Many people have only limited experience dealing with persons with dementia, so they may not know what to do during their visits. You can make the following recommendations to family members. Bring up memories as statements, not questions. This keeps the pressure associated with answering a question off the resident. Visit in a quiet spot with few distractions. Do not visit in large groups of people and keep visits short. Smile and do not be afraid to touch the resident. Touch can be very helpful. Help the resident with an appropriate activity or go for a walk. Summary. Person-centered care involves maximizing the resident's functional ability by avoiding the frustration and anger that so often accompanies dementia. You can do this by always using the appropriate communication techniques to ensure the resident understands the message you are sending. Make sure you are adapting the resident's physical environment and the way you provide ADL care to meet the resident's needs. However, you may still have to deal with difficult behaviors, so remember that most behaviors have a meaning. Attempt to identify the meaning behind the behavior so that you can implement the most appropriate interventions. Conclusion. Summary. Now that you have finished reviewing the course content, you should have learned the following. Your job as a caregiver for residents with dementia is very challenging. It is full of frustrations for both you and the resident. Having an understanding of the effects of dementia on residents and their loved ones will help you provide the highest quality of care possible. However, you must remember that the person is more than their disease, so providing high-quality care involves using a person-centered approach to maximize residents' functional ability. By using the guidelines provided in the course, you will be able to better care for residents with dementia. Course contributor. Jennifer Moore, RN, has worked in the senior care industry for the past 13 years. She has held positions including MDS Coordinator, Director of Nursing, Medicare Nurse Coordinator, Nurse Consultant, Area Manager, and Director of Quality Assurance. Her overall responsibility within each of these positions was to ensure residents received the highest quality of care. This included active participation in quality improvement initiatives, review of clinical records to identify areas of weakness, corroboration with the medical director to institute policies and procedures for resident care, and staff education training. Additionally, she was responsible for maintaining an effective compliance program under a quality of care corporate integrity agreement with the Office of Inspector General for a period of 5 years. She currently serves as a content developer for Relias Learning. Within this position, her responsibility is to develop and review online training modules for the senior care industry. She has served as the subject matter expert for courses on rehospitalization, clinical skill reviews, and various OSHA and regulatory compliance topics. In addition, she has presented at various state conferences on mandatory compliance, quality assessment and assurance, QA&A, and quality assessment and performance improvement, QAPI. Congratulations! You have finished reviewing the course content. Please close this window to continue.